missing Dr. T. Ladies and gentlemen, we'll be starting in a couple minutes. If you could mute your phones, please, prior to the conference. Just mute your phones. Thank you. We're going to get him. He's right here.
Bottle. There's a water bottle on the podium, and I have more behind the scenes.
Everybody good to go? All right. Yeah, I agree. Yeah, exactly. Good morning, everyone. My name is David King. I'm the director of the San Diego Imperial Valley HIDA, and I am proud to be your MC for today's International Overdose Awareness Day. Welcome. This year's theme is One Big Family Driven by Hope. The overdose crisis doesn't just break families, it fractures our communities. But today, we gather as one united family: public health, public safety, prevention, and more importantly, parents and family members that have lost loved ones to overdose. Behind me are 945 purple flags, each one honoring a life lost to overdose. That is a tragedy, but there is hope. Last year, there were 258 more flags on this lawn than there were today. While that's encouraging, the danger of fentanyl, methamphetamine, counterfeit pills remains. We're here to remember, to educate, and to act. Let's begin from hearing from our first family member in this shared fight, San Diego County District Attorney Summer Stephan.
Good morning, everybody. I'm Summer Stephan, San Diego County District Attorney, and I am proud to stand here with all of the families that have educated us about what it means to lose a loved one to an overdose. I'm proud of their resilience, our community. I'm proud of their courage. And today is very special while we see these flags behind us. We also know that there could be more people lost, but for the whole efforts of law enforcement, prosecutors, and the community, the voices of lived experience and of families that have lost loved ones, they've helped us transform this issue into a human issue that we all see every day and we care about, and it's a priority fight. The Substance Use and Overdose Task Force is a unique model in San Diego County. It doesn't exist in this form anywhere in the United States. I'm proud to co-chair this task force with Dr. Jardina. It shows that health and safety can come together to push back against greedy cartels and drug dealers. That all they want to see is profit, and every day they make substances that are stronger and more addictive and more poisonous. And we must continue to fight back against them. The numbers today show that we are on the right track. We see that we have huge reductions in both fentanyl and methamphetamine. We see that the numbers have gone down in both areas. But the real data point that I want to talk about is the data point when it comes to our children that are under 18 years old. This has been a passion focus by all of the people that you see here. And in just a few years, we went from 13 young lives, the youngest being 13 years old, that died from a fentanyl overdose, to 0 this year. Can you imagine how many parents were spared that loss of a young child, of walking into their bedroom and they are feeling stress at school and they just ordered what they thought was an Adderall online or a pain pill, and instead they got poisonous fentanyl. So that is good news. What we see holding steady, and something we have to continue to work on, is the overdose deaths disproportionately affect our homeless population because they're not able to access treatment. 30% of the overdoses are because of our homeless neighbors and community members. We must continue to emphasize lifting them from the streets so that they can access the great treatment that San Diego County offers. One thing I want to make sure that anybody who's listening out there understands. We now have Alexandra's Law, named after a beautiful young woman who lost her life to fentanyl, Alexandra Capelouto. And what this means is in every courtroom, they get an Alexandra advisory if they are drug dealers. And this advisory tells them the next time you sell a toxic drug and someone dies, you could be held responsible for a murder. This is being read in every courtroom. And, you know, the numbers are in the thousands, because that's the number of our prosecutions. So I think today we have a message where we continue to grieve, but we also embrace the hope in the saved lives due to the effort of the entire community and improved laws that help us fight back. Thank you, and it's my honor to introduce Dr. Kimberly Jardina, who is the head person in Health and Human Services that oversees the treatment that is life-saving. Thank you.
Thank you, District Attorney Steffen. It really is an honor to get to co-chair the Substance Use and Overdose Prevention Task Force with our District Attorney, who has always understood the importance of bringing together health, social services, and public safety so that we can drive real community solutions to our drug use and overdose issues in our county. So thank you so much, DA Steffen, for your leadership in this work. As the District Attorney said, I'm Dr. Kimberly Jardina. I'm the Deputy Chief Administrative Officer for the Health and Human Services Agency with the County of San Diego. HHSA includes 2 of the county's central departments that are undertaking work related to substance use and overdose prevention, our Public Health Services and Behavioral Health Services departments, and you'll get the opportunity to hear from both of them a little bit later. But personally, I would like to ask all of us to just pause for a few moments and really take in the number of flags that are here on the lawn today. There are so many. As you walked in, hopefully you had the same reaction I did, a little bit of a pause, a little bit of a gasp, when we saw 945 of them in total. Each flag represents a person, someone who was loved by their parents, their siblings, and their friends. Many overdose deaths in San Diego County are from fentanyl, an insidious drug oftentimes snuck into other illegal medications to make them cheaper, more powerful, and addictive. Fentanyl can be deadly. It is up to 50 times stronger than heroin and 100 times more potent than morphine. Fentanyl-related emergency department visits are 58% higher than in 2019. But as you've heard, there is some hope. Overdose deaths overall are trending down, which you will hear more about. From 2021 to 2023, overdose emergency department visits also are declining, down 14% between 2021 and 2023, while methamphetamine-related visits fell 75% over that same time. These trends show that we can keep overdose numbers on the decline. Targeted awareness, equitable access to naloxone, and focused outreach work. Our efforts are having an impact, and together, we are building stronger connections across systems, engaged communities, an informed public, and the passion to make a difference, one life at a time. Because every flag and every life is worth it. So thank you all for your support and for being here. I'm honored to introduce Dr. Jonathan Lucas, our Chief Medical Examiner for the County of San Diego.
Thank you, Dr. Jardina. Good morning, everybody. My name is John Lucas. I'm the Chief Medical Examiner for the county. At the Medical Examiner, we see the most final outcomes of this crisis. Every overdose death in San Diego County comes through my office. And together, those cases tell us the full scope of the loss that we face. As you've heard, in 2024, we recorded 945 deaths due to overdose, 258 fewer than the year before. The downward trend is encouraging, but it still means nearly 1,000 lives lost in 1 year. 2 drugs remain at the center of this crisis: fentanyl and methamphetamine. Fentanyl are responsible for 494 deaths and methamphetamine for 600. A third of all overdoses involve both drugs, a particularly lethal combination. And finally, fentanyl and methamphetamine account for almost 90% of the overdose deaths in the county, almost 90% of those flags back there. We never lose sight of the fact that behind every one of those numbers is a name and a story. Their sons and daughters, parents, siblings, and friends. And it's those that grieve are the ones that we work with, trying to help them find answers and understanding in the midst of loss. Most commonly, these deaths are occurring in homes, bedrooms, kitchens, living rooms, out of view of the general public. My office's responsibility is to document the truth of how these people are dying. That truth then becomes part of the public record. But it is also what helps families understand what happened and is what helps guide our community's response. As we mark each life with a flag today, we carry the hope that in the years ahead, far fewer flags will stand on this lawn. And now I'd like to introduce DEA Acting Special Agent in Charge, Jake Galvan.
Thank you, Dr. Lucas, and good morning, everybody. My name is Jake Galvan. I'm the Acting Special Agent in Charge for the DEA here in San Diego. In 2024, the DEA seized over 60 million counterfeit fentanyl pills and 8,000 pounds of fentanyl powder. That's enough for 380 million lethal doses. Over half of the fentanyl seized in the United States enters through the southwest border. While fentanyl deaths have declined, our work isn't done. So far in 2025, over 4,000 pounds have already been intercepted. The threat of counterfeit pills and fentanyl continues to grow, but we are united in purpose, relentless in our pursuit, and driven by the belief that we can and must save lives. I've worked in 3 of the 4 field divisions for the DEA on the West Coast. With that, I work with families from Alaska, Washington State, Idaho, Oregon, and now California who have lost somebody to a pill poisoning. And I can't stress this enough. Enforcement is essential, but it's not enough. We need education, prevention, and community awareness. Together as one big family of public health and public safety, we fight forward, driven by hope. Thank you. It's my honor to introduce Captain Chris Katra, San Diego County Sheriff's Department.
Good morning. I'm Captain Chris Katra with the Sheriff's Office Special Investigations Division. In 2024, our deputies responded to over 500 overdose calls. 500. Some of those calls ended in tragedy, as you can see by the purple flags behind me today. Today, I want to speak about 2 efforts our office is making to reduce those tragedies. First, our harm reduction efforts. For several years, our deputies have been equipped with naloxone. It's a life-saving medication that reverses the effect of opiate overdoses. Often our deputies are the first to respond to a scene of an overdose. Having naloxone and their ability to administer it is a game changer. I've witnessed it firsthand. Last year, our deputies deployed naloxone over 60 times. That's 60 lives that, without that life-saving medication, could have been lost, could have been a flag represented by us today. We also carry harm reduction kits and offer those to victims and families of overdoses. It includes this box right here with naloxone and a pamphlet with resources to get help. These kits were distributed 1,423 times last year. These kits are available at every sheriff's station and substation for free. Let me repeat that. They are offered at every station for free, no questions asked. While our harm reduction efforts are vital in saving lives, we also recognize the importance of preventing these dangerous drugs from ever reaching our communities and our children. This leads me to our prevention efforts. There's an old saying, an ounce of prevention is worth a pound of cure. Every day, we work with our local, state, and federal law enforcement agencies to arrest drug dealers and seize their drugs. We are committed to preventing these drugs from ever reaching our communities and our children. But our efforts in harm reduction and prevention are not the only part of the solution. The strength of our community plays a crucial role in this. This is what I want you to take out of this. We protect our communities like family. A lot of our deputies live in the communities they patrol. Our success depends on each other. We encourage our community to report any suspicious narcotic activity. Your call could save a life. Let me repeat that. Your call could save a life. Thank you. I'd like to introduce our next speaker, Adam Gordon from the U.S. Attorney's Office.
Thank you, Captain Catra. So I'm Adam Gordon, and I serve as the United States Attorney here in the Southern District of California. I'm the Chief Law Enforcement Official for San Diego and Imperial Counties, but more importantly for today, for 3 years before I got this job, I served as the opioid coordinator for our office. That means that I prosecuted numerous individuals for providing deadly doses of fentanyl that ultimately killed their victims. I don't want to tell you about a success today, though. I want to tell you about a failure, and more specifically about one of my failures. So there was a case of a defendant by the name of Cole Thomas Salazar that I want to briefly talk to you about. So it's not actually his story, it's the story of two sisters, Megan Fusel and Sarah Fusel. Sarah was out here living in San Diego, and she tragically passed away. Her sister was living in Oklahoma City with her parents. Sarah was only 24 years old when she passed away in November of 2020 by the powdered fentanyl sold to her by Mr. Salazar. As often happens while prosecuting these cases, I became very close with the families. So we would talk often about the status of the case, trying to give them updates, trying to talk about what we were planning to do in this particular case if it went to trial. So for a year, I would try to answer all of their questions. I met Megan and her mom for the first time when they came out here for the sentencing. They were here to speak about the impact that Sarah's death had had on their family. So we chatted in my office for a couple hours about how vibrant Sarah had been and what a caring person she was for everyone who knew her. Megan actually gave me this button that I keep up in my office right before the sentencing. Megan was incredibly well-spoken, and I found out later she was valedictorian of her high school. She had obtained a magna cum laude degree in mathematics from college, and then had obtained a combined degrees of a master's of public health and a doctor of medicine. Right? This is Megan. This is the sister. The sentencing took place on October 19th of 2022, which was a Wednesday. And as these sentencings are, it was very emotional. It was challenging for everybody involved, the lawyers, the judge, the family. So that Sunday, right, 3 days after the sentencing, I'm waiting to go to lunch with my wife. And I get a call from the case agent from Team 10, and he said, I have the worst news. He said, Megan died. She overdosed and died in her house in Oklahoma City, 4 days after that sentencing. And it felt like everything below me had just disappeared. So Megan was bright and vibrant, and I just couldn't stop thinking of Megan's mom discovering her other daughter dead in her home, of losing her last daughter in that way so soon after the sentencing. And what had I done wrong? Because what had I missed, right? Prosecutors are supposed to be cynical and inquisitive and observant, and none of that, none of those bells had rang when I was talking to Megan so soon before her death. So I tell you Megan's story because I think everybody here has experienced adversity, and I'm going to use a stronger word, tragedy. I know Tim, I know Catherine has experienced that.
When that floor drops out from under us, what steadies us, what brings us back from despair is each other. It's each other. So today I ask you this: kindness, patience, and hope aren't just virtues, they're lifelines. Addiction and pain can be silent killers, and sometimes the person who needs saving is sitting right in front of you. I'll end with this. As we remember these two sisters and the pain that their family has endured, let's not wait for tragedy to open our hearts. You never know who's going to need your hand to guide you back to that steady ground. So thank you, and I have the pleasure of now introducing Denise. Please.
Well, hello, my name is Denise Barnes. Thank you. And I was invited here today to talk about my son, Cameron Barnes, who meant everything to our family. He has 2 older siblings that just miss him terribly. And my son grew up in a Christian home, lots of love. He was like gifted with so much talent. He was an amazing athlete, smart, funny, all the cliches that you hear from parents when they are speaking about their loved ones. He was taught right from wrong from the very beginning. He enjoyed surfing with his dad, motorcycles, lacrosse, football, wrestling, everything. Bright kid. He had no idea how blessed he was and how blessed we were to have him. But tragically, one day we got a phone call, February 8th. I didn't recognize the number, so we didn't pick it up. And the call was from the morgue, saying that Cameron had passed away. And he is one of these flags out here representing a loved one who's lost. And now we're left with this, devastation. And our hearts are just shattered completely. There's no word in the dictionary that describes the pain that a mother feels when they lose their child. And I am here just to make sure I get this life-saving message out to all of you and everyone who's watching. Please help me in saving lives and tell your friends and your family. In the event with my son, when he stopped breathing, the girl that was with him didn't call 911. So I don't know if that was just a fear, like the speaker was saying earlier, that of getting arrested, getting in trouble. So they don't call. The person used Narcan spray on my son and said, we just went back to sleep. And he has just met her a couple weeks ago. So 8 months later, we waited for the toxicology report, and it was fentanyl. It was a Xanax counterfeit drug, which is basically poison, and it was laced with fentanyl, and he didn't wake up. And just through our faith and God and support, we're just trying to get through one day, It's just one day. Seconds go by and your memories don't stop of your child. It just kills you. But today I want to spread awareness about Narcan plus 911. It's like they're married. They got to go together. When you're in a situation, young teen, adult, whatever, and someone's passed out or not breathing of an accidental overdose, don't just rely on that Narcan, because it gives you a false sense of security with these potent counterfeit drugs that are out there with these young adults and teens, make that call. If you have to, leave the room, but call 911 because you need to call the paramedics and the fire department. That Narcan is just temporary, basically 30 to 90 minutes. It just buys you time. It doesn't take the drug that's in your system that stopped you breathing in the first place. That's what the paramedics are there for. That's why you go to the hospital. That's why they're filling your system up with this naloxone, which is the ingredient of Narcan, until it's completely out. And so my message to you is please help me today. And I want to save a life. I want to save many lives. I can't stop the drugs that are coming in or people taking them, but I can try to stop the senseless accidental overdose deaths by not calling 911. Please call 911. And I just want to thank you again for listening and being here today. Everyone has lost a loved one, and I feel your pain, but I don't want any other mother to feel my pain. So please help me, and thank you. Next is Nadia Kivara.
Good morning, everyone. My name is Nadia Pravara. I am the Acting Behavioral Health Services Director. Nationally, approximately 1 in 6 adults have a substance use disorder, with nearly half of those experiencing co-occurring mental illness. In San Diego County, that's close to 450,000 people, highlighting both the importance of addressing these challenges and the opportunity we have as a community to support behavioral health and recovery. And we know prevention and treatment save lives. To ensure people have access to substance use care, behavioral health continues to expand services across outpatient, residential settings, and housing. We also remain committed to harm reduction work, including naloxone distribution in partnership with our public health partners. Recently, we launched the San Diego Relay program that provides 24/7 peer support response in select emergency departments locally to support people following an overdose. Through peer-led warm handoffs, the program helps people transition from emergency departments to services such as harm reduction, treatment, and recovery services. Since its inception in February of this year, the San Diego Relay program has already received over 100 referrals and enrolled over 90 participants. To illustrate the connection to how treatment can impact a person's life, I'd like to share a recent client story. At 24, a young woman was actively using substances when she entered one of our narcotic treatment programs 2 days after giving birth. Her infant son was subsequently placed in foster care. She enrolled in and successfully completed residential substance use treatment, transitioned to sober living, and completed a medication-assisted treatment program. She secured employment, received a housing voucher, and now resides in her own apartment. She maintained compliance with child welfare requirements and was able to be reunited with her son. This story is just one of many, highlighting the need for prevention and coordinated care to support people in their recovery journeys. As we remember those who we've lost to overdose, let us hold on to hope. Through prevention, compassionate care, and support, we can turn hope into healing to ensure that nobody has to face addiction alone. I'm going to now turn it over to my colleague and friend and public health officer, Dr. Sayon Tiolo. Gosh, I can never get it.
You're good. Thank you. Thank you so much, Nadia. Good morning, everyone, and thank you so much, Nadia, and really thank you to everyone here. You see here behind me a huge one big family, as mentioned, and really we can't do it without you all as well. So my name is Sayon Tihaloli-Pavin. I'm your public health officer, and it is so important for us to continue to raise awareness about the public health crisis and our work that we need to continue doing together to collectively lower deaths from drug overdose. Behind every single one of these flags is a person, as you've heard the stories, and not only their family and their, but also a story of their life and their tragic preventable death. And we need to continue to do everything that we can upstream to prevent substance use in the first place, while also simultaneously making it easier for our community of users to access treatment, including medications for opioid use disorder, for example, which are really, really effective. And so, as you've heard several times today, recognizing an overdose and using life-saving naloxone and calling 911 is critical when someone is facing an overdose. Signs of an overdose include small and pinpoint pupils, falling asleep or loss of consciousness, slow or shallow breathing, choking or gurgling sounds, limp body, and discolored or blue skin or lips. We are doing so much with our community partners and across health and safety to drive down these overdose deaths, but there are still some groups that are disproportionately impacted more than others. You heard our district attorney talk about people experiencing homelessness. 30% of our deaths were amongst people experiencing homelessness. And just to highlight a few other disparities, male San Diegans had more than triple the death rate of women. White San Diegans are dying from drug overdose deaths at a higher rate than the overall county rate. And Black or African American San Diegans are dying at twice the rate of white residents in San Diego. So that's an even higher disparity. Adults aged 45 to 64 experienced the highest overdose death rate in 2024. And people experiencing homelessness, as I mentioned, accounted for 30% of deaths. Geographically, our urban and rural populations are suffering. While central San Diego had the highest rate of drug overdose rates, Mountain Empire, Palomar, Julian, Lemon Grove, and Palma had also really high overdose death rates, well above the overall county death rate. So as you hear here, robust data can help us better track the crisis, can inform treatment and prevention strategies, and save lives. In the fall of 2023, we came together under the Substance Use and Overdose Prevention Task Force, and the county launched what's called the Overdose Surveillance and Response Program, or OSAR, to strengthen our response to the overdose crisis through the power of cross-agency collaboration. By uniting public health, behavioral health, emergency medical services, and the medical examiner, OSAR ensures a coordinated life-saving response rooted in prevention and action. OSAR tracks overdose trends, detects crisis events, and pinpoints geographic hotspots using real-time data to guide targeted health interventions. Real-time data means real-time response. When spikes occur, our teams deploy to affected areas with naloxone, with fentanyl testing strips, with referrals to health and community service like the ones that you see behind us. OSAR raises awareness and promotes harm reduction and connects individuals to local resources to prevent overdoses before they happen. In the next few days, OSAR is launching a public and interactive user-friendly dashboard as well that'll complement our annual report and be updated routinely throughout the year. So finally, I want to thank again our public safety partners, our public and health partners, and our community partners, as together joining efforts as one big family across health and safety and community is what we need to continue to drive down overdose deaths. Thank you. And I'll turn it back to Director Kay.
Thank you, Dr. Tialoli Pavin. I think I got that right. We don't want to come back here year after year and see these flags. There's no more sense of urgency that we have to reduce overdose deaths. They're 100% preventable. And it takes public health, public safety, prevention, parents, community partners. We're all in this together. While we thank all of the distinguished speakers on the stage, it's really all of you out in our audience and the community that's going to make a difference in San Diego County, California, and across the United States. It's unacceptable at the height to lose 107,000 people. You saw what after the country's response after 9/11, and justifiably so. We have to act with that same sense of urgency all of our elected officials, community members, to end this overdose crisis. While it gives us hope that there's a drop, we must expand access to prevention, treatment, and support. On August 31st, the County Administration Center behind me will glow purple, a symbol of remembrance. Let every light be a vow. No more names added to these flags. Together, we are one big family driven by hope, and we will never stop fighting for each other. Thank you very much. All of the speakers are available for interview afterwards. God bless, and we'll talk to you soon.